Okay, hi again, Laura.
Hi.
So now we're gonna move on to a heart examination. I have you on the modified examination table. So first I'm gonna just do a general inspection. I'm gonna look at the skin for any lesions in your chest area, any scars, anything to be worried about. And then I'm gonna move on to your fingers, look for cyanosis, any clubbing, any like cracks in your nails or anything, which is fine. And next, I'm gonna check out your jugular vein. So can I have you look towards that wall, about 45 degrees? So then I should see it. I should have you up at like 45 degrees. You're okay right there. So it's not super prominent. I can't see a big pulse, which is a good thing. I don't think you have right-sided heart failure. If I was worried, I could also push up on your liver and see if that caused any backflow. But that is good. And then next I can have you lay back. I'm going to find your apical impulse, which is where the heartbeat can be felt and seen the strongest. So can I have you lift your shirt up to just under your breast tissue? So first I'm going to look and see if I can see it, which there's a little pulsation there, and then I can palpate it. And I'd just be feeling for like left ventricular enlargement, but yours seems pretty normal. And then next I can go into percussion, so I'm just going to find the borders of the heart. So I'm going to start from lateral to medial in the second intercostal space. I'm just listening for the hollow to a more solid thud. And then it's the second, third, and fifth space. And I would do that on both sides to give me a general idea, make sure there's no abnormal enlargement going on. So next I'm going to palpate over some of the areas, feeling for any thrills or heaves or abnormal large bumps. So I'll start with the aortic valve, which is second intercostal space just left of the sternum. That's fine. And then the pulmonary, and then tricuspid, and then mitral. I need to get under that spot again at about the midclavicular level, and that's good. And next I'm gonna auscultate, so I'm just gonna use my diaphragm on the stethoscope over those same areas, and I'm gonna be listening for any murmurs or galloping or anything. Over to the pulmonary valve, and then go to Erb's point, which is right in between the pulmonary and the tricuspid. And then down to the mitral valve. And that all seems good. And if I was worried about, say, a mitral valve issue, I can find a way to make it a little bit louder by looking at mitral valve regurgitation by having you sit up. Ooh, I dropped the chair. And then I'm going to use my stethoscope under the mitral valve point, and then I would have you take a breath in and exhale out all the way as you're leaning forward, and I would be able to hear it a little bit better. And another way, when you're laying down, so similar, I could have you just roll over to your left about 45 degrees, and then exhale out the whole way and hold it, and then it would get a little bit louder too. And that's about it. Thank you.